Well, there's a few interesting takeaways from the talks from today. So I was presenting the updates for colorectal cancer from ASCO. The first one was a discussion about rectal cancer. What do we do for those patients who are undergoing surgery with curative intent? And after that, we want to define what's the best next step regarding treatment in the adjuvant setting. So the ADORE trial was this trial that is a phase 3 randomized clinical trial where they assessed based on pathologic responses following chemoradiation and surgery, how well they responded or not, and tried to allocate it to either 5-FU leucovorin versus FOLFOX. And we know now that in the past, we only care about clinical staging before chemo and radiation and surgery. Now, we also have to look into the pathology after surgery and radiation. And if we see the patient may have not responded well to treatment or they have a high-risk disease, then we feel more confident to offer those patients a combination of FOLFOX as the adjuvant next line of treatment for them. So that's one important takeaway from the data. Other things that we talk about today in the colorectal cancer space was the use of maintenance treatment after the patient has achieved response in the metastatic setting. So many patients get FOLFOX, for example, in the first line, along with an EGFR inhibitor, in this case panitumumab, when they are RAS wild type. So what do we do after the patient gets, let's say, 4 months of treatment, they get a good response, and you want to hold maybe oxaliplatin to allow the patient to have a good profile, safety profile. So the study results from the Valentino study, they showed that the combination of 5-FU leucovorin and panitumumab was superior to panitumumab alone in the maintenance setting when the oxaliplatin is no longer used. So this is something very interesting that is going to potentially impact the way we treat patients as well.